My name is Heun, I'm a consultant psychiatrist, and we report about mental disorders in our series from the Global Psychiatric Association. And today I would like to talk about sleep-related dissociative disorders. Dissociative disorders in general are related to a feeling of being disconnected from the world and from itself. It's can be agitated state, but there can also be states where people are unsure about their ego and their identity. In some cases, there are personality disorders related, and sometimes the pain can be reduced. Sometimes also in dissociative disorders, there is an increase of self-harm. Right. Now we come to sleep-related dissociative disorders, which have been described in the late 70s. Happens in patients who have a history of physical or sexual abuse in childhood or adulthood. Usually, dissociation doesn't only occur during the night, but also during the day, and sometimes it's related to self-harm. Because this EEG or polysomnography would show a state of alertness and not of sleep, it hasn't been included in parasomnia classifications. So in this respect, they are called dissociative pseudo-parasomnias, or nocturnal dissociative disorder, or psychogenic nocturnal dissociative disorder, or hysterical somnambulism. Somnambulism means that someone moves around during the night. And the polysomnography I was referring to shows sometimes more complex and lengthy behavior, and might be related to re-enactment of previous trauma or abuse, and it can occur during wakefulness after episodes of sleep. There's a differential diagnosis of other disorders of arousal, which might be related to other dissociation or even epilepsy. Usually, because it's an dissociative disorder, psychotherapy might be worth a trial. It might take quite a while, and sometimes it may even require inpatient assessment to see whether other brain factors are involved. Sometimes benzodiazepine are tried, but usually they shouldn't, because they make the problems more severe and sometimes exacerbate the problem. So in this respect, they should be avoided. So what you can do is more or less treat the underlying problem which led to this disorder in a way of using psychotherapy. I hope this is informative, and if you like our videos, please subscribe. Thanks for your interest. Goodbye.